Hello everyone, and thank you for joining me today. Whether you're here because you've been personally affected by Lyme disease, know someone who has, or are simply curious to learn more, I'm glad to have you. Lyme disease is a topic that touches many lives, yet it remains widely misunderstood. Today, we're going to dive deep into this complex illness, exploring its symptoms, diagnosis, treatment options, and the long-term impacts it can have on health. Our focus today is on Lyme disease Unveiled, a comprehensive guide to symptoms, diagnosis, treatment, and long-term health impacts. This guide aims to provide a clear, detailed understanding of Lyme disease, from the moment a tick bite occurs to the potential challenges of living with chronic symptoms. We'll cover what Lyme disease is and how it spreads, the stages and symptoms of the disease, including the infamous bullseye rash and lesser-known neurological and cardiac complications, how Lyme disease is diagnosed, including the strengths and limitations of current testing methods, treatment options, from antibiotics to the controversies surrounding chronic Lyme disease and long-term antibiotic use, the long-term health impacts of Lyme disease, including post-treatment Lyme disease syndrome, PTLDS, and its effects on quality of life, prevention strategies to reduce the risk of tick bites and Lyme disease. By the end of this discussion, you'll have a thorough understanding of Lyme disease and the tools to navigate its challenges, whether for yourself, a loved one, or simply to stay informed. Let's get started. Lyme disease, caused by the bacterium Borrelia burgdorferi and transmitted through the bite of infected black-legged ticks, commonly known as deer ticks, is a complex and often misunderstood illness. It can have significant implications for health if not diagnosed and treated promptly. Below is a detailed analysis of Lyme disease, its symptoms, diagnosis, treatment controversies, and long-term health impacts. 1. What is Lyme disease? Lyme disease is a vector-borne illness primarily caused by the spirochete bacterium Borrelia burgdorferi. It is most commonly transmitted to humans through the bite of infected ixodes ticks. These ticks are often found in wooded or grassy areas, particularly in regions like the northeastern and midwestern United States, Europe, and parts of Asia. The disease progresses in stages. Early localized stage, characterized by a rash, erythema migrans, at the site of the tick bite, flu-like symptoms, and fatigue. Early disseminated stage, occurs weeks to months after the bite, with symptoms like multiple rashes, neurological issues, example, facial palsy, meningitis, and cardiac problems, example, Lyme carditis. Late disseminated stage, develops months to years later, potentially causing chronic arthritis, neurological complications, and cognitive impairments. 2. Symptoms of Lyme disease Lyme disease symptoms vary depending on the stage of infection and can mimic other conditions, making diagnosis challenging. Early symptoms, 3 to 30 days post-bite. Erythema migrans, EM, rash, a bullseye rash that expands gradually, occurs in 70–80% of cases. Fever, chills, and fatigue. Muscle and joint aches. Swollen lymph nodes. Later symptoms, weeks to months post-bite. Severe headaches and neck stiffness. Additional EM rashes on other parts of the body. Facial palsy, loss of muscle tone on one or both sides of the face. Heart palpitations or irregular heartbeat, Lyme carditis. Dizziness, shortness of breath. Nerve pain, numbness, or tingling in the hands or feet. Cognitive issues, such as memory problems or difficulty concentrating. Chronic symptoms, months to years post-bite. Chronic joint inflammation, particularly in the knees. Neurological symptoms, including neuropathy and encephalopathy. Persistent fatigue and cognitive dysfunction, sometimes referred to as post-treatment Lyme disease syndrome or PTLDS. 3. Diagnosis of Lyme disease Diagnosing Lyme disease can be challenging due to its nonspecific symptoms and the limitations of current testing methods. Diagnostic tools Clinical evaluation, a history of tick exposure and characteristic symptoms, example, EM rash, can strongly suggest Lyme disease. Laboratory testing ***. Two-tiered testing. The CDC recommends an initial ELISA test followed by a Western blot test for confirmation. However, these tests may yield false negatives in early stages due to the time it takes for antibodies to develop. PCR testing detects bacterial DNA but is less commonly used. Lumbar puncture, used if neurological symptoms suggest Lyme meningitis. #challenges in diagnosis ***. False negatives are common in early stages. Symptoms overlap with other conditions like fibromyalgia, chronic fatigue syndrome, and multiple sclerosis. Lack of a definitive test for chronic Lyme disease or PTLDS. #4. Treatment of Lyme disease ***. Lyme disease is typically treated with antibiotics, and early treatment is highly effective. #standard treatment ***. Early stage Lyme, oral antibiotics like doxycycline, amoxicillin, or cefuroxime for 10 to 21 days. Late stage or neurological Lyme, intravenous antibiotics, example, ceftriaxone, for 14 to 28 days. #controversies in treatment ***. Chronic Lyme disease, some patients report persistent symptoms after treatment, leading to debates about whether the infection persists or if the symptoms are due to an autoimmune response or tissue damage. The medical community is divided on whether long-term antibiotic use is effective or safe for these cases. Post-treatment Lyme disease syndrome, PTLDS, a small percentage of patients experience lingering symptoms. Example, fatigue, pain, cognitive issues, after treatment. The cause is unclear, and there is no proven treatment. #5. Long-term health impacts ***. If left untreated or inadequately treated, Lyme disease can lead to serious long-term health issues. Chronic joint inflammation, Lyme arthritis, can cause persistent swelling and pain, particularly in the knees. Neurological damage, peripheral neuropathy, cognitive impairments, and memory problems may persist. Cardiac complications, rare but serious, Lyme carditis can disrupt the heart's electrical system. Mental health effects, chronic symptoms can lead to depression, anxiety, and reduced quality of life. #6. Prevention of Lyme disease ***. Preventing tick bites is the best way to avoid Lyme disease. Use insect repellent containing DEET or permethrin. Wear long sleeves and pants in wooded or grassy areas. Perform thorough tick checks after outdoor activities. Remove ticks promptly using fine-tipped tweezers. Consider landscaping modifications to reduce tick habitats around homes. 7. Controversies and misconceptions. Lyme disease is a topic of significant controversy, particularly regarding chronic Lyme disease and its treatment. Chronic Lyme debate. Some patients and advocacy groups argue that chronic Lyme disease is a persistent infection requiring long-term antibiotics. However, most medical organizations, including the CDC and IDSA, state there is no evidence supporting this approach, and warn of the risks of prolonged antibiotic use, example, antibiotic resistance, secondary infections. Overdiagnosis and misdiagnosis ***. The nonspecific symptoms of Lyme disease can lead to overdiagnosis or misdiagnosis, with some patients being treated for Lyme disease when they have other conditions. 8. Research and future directions ***. Ongoing research aims to improve Lyme disease diagnosis, treatment, and prevention. Better diagnostic tests, development of more accurate tests for early detection and chronic Lyme disease. Vaccines. Efforts are underway to develop a new Lyme vaccine for humans. A previous vaccine, Lymerix, was discontinued in 2002. Understanding PTLDS, research into the mechanisms behind persistent symptoms and potential treatments. Lyme disease is a complex illness with significant implications for health if not diagnosed and treated early. While most patients recover fully with prompt antibiotic treatment, some experience lingering symptoms that remain poorly understood. Prevention through tick avoidance and prompt removal is crucial, and ongoing research holds promise for better diagnostic tools, treatments, and preventive measures. If you suspect Lyme disease, seek medical attention promptly to ensure the best possible outcome. Here are some reliable and up-to-date references for detailed information on Lyme disease, including its symptoms, diagnosis, treatment, and ongoing research. These sources are widely recognized for their accuracy and credibility in the medical and scientific communities. ###1 Centers for Disease Control and Prevention, CDC, ****. The CDC provides comprehensive information on Lyme disease, including epidemiology, prevention, diagnosis, and treatment guidelines. Website, CDC Lyme disease, https://www.cdc.gov/Lyme. Key topics: symptoms and stages of Lyme disease, diagnostic testing and interpretation, treatment recommendations, prevention strategies, example, tick avoidance, repellents, data and statistics on Lyme disease cases in the U.S. ###2 National Institute of Allergy and Infectious Diseases, NIAID, ****. NIAID conducts and supports research on Lyme disease and other tick-borne illnesses. Website, NIAID Lyme Disease Research, https://www.niid.nih.gov/diseases-conditions/Lyme-disease. Key topics: ongoing research on Lyme disease pathogenesis, development of new diagnostic tools and vaccines, studies on post-treatment Lyme disease syndrome, PTLDS. ###3 Infectious Diseases Society of America, IDSA, ****. The IDSA provides evidence-based guidelines for the diagnosis and treatment of Lyme disease. Website, IDSA Lyme Disease Guidelines, https://www.idsociety.org/practice-guidelines/Lyme-disease. Key topics: clinical practice guidelines for Lyme disease, recommendations for antibiotic treatment, discussion of controversies, including chronic Lyme disease. These references provide a wealth of information for understanding Lyme disease, its impact on health, and the latest advancements in research and treatment. Always consult healthcare professionals for personalized medical advice. Encourage viewers to share their experiences ****. If you or someone you know has been affected by Lyme disease, I'd love to hear your story. Share your experiences, challenges, or tips for managing symptoms in the comments below. Your insights could help others feel less alone in their journey. If you found this video helpful, please give it a thumbs up and share it with anyone who might benefit from this information. Lyme disease is a topic that deserves more awareness, and your support can help spread the word. Don't forget to subscribe to the channel for more in-depth content on health, wellness, and medical topics. Together, we can build a community of knowledge and support. Thank you for watching, and I'll see you in the next video.